My first patient, a 30-year-old woman who had two little children and had breast cancer and dying. She
Hmm.
always has stayed in my mind because after all this suffering, she said, "It's not your fault, Dr. Rahman." Now, what kind of person he had to be to say that?
So, Dr. Rahman, you have had multiple publications in New York Times, Wall Street Journal, The Lancet, and there was one in particular that stuck with me. So, Dr. Rahman reflects on a moment when the roles of a doctor and a patient were suddenly reversed in his life. And you mentioned that physicians often they begin to understand their patients a lot better and a lot more fully when the physicians themselves confront illness.
Science is very important part of medicine. You cannot have medicine without science. But science cannot feel your anguish. Science cannot feel your doubts. Science cannot feel your pain. So how do you understand those things before you go to the patient?
Thinking about both of the books you've written, The Temple Road and Our Connected Lives, you wrote one book about your own journey, and you wrote the other book about patients and their experiences. Which stories do you feel were harder to tell?
Sometimes it's very hard to tell your own stories because sometimes you want to forget it because you have enough on your plate now. There was a young girl I took care had ewing sarcoma of the kidney, and then about something like 20 years later, my secretary says, "There's a pretty young lady sitting there and she wants to talk to you." So I got intrigued and I saw her, and then I kind of looked at her for almost half a minute, and she smiled. She says, "I'm so and so. Don't you remember?" And
Oh,
we used to call her Pancake Monster because during chemo she won't eat anything else except pancake. Okay.